Good evening, everybody, and welcome to our next Q&A session. Obviously, as you've registered, you'll know that we're going to be joined by Laura Hopwood tonight, who is a specialist respiratory physiotherapist at Alder Hospital. So, Laura, welcome, and thank you for giving up your time tonight. So, without further ado, we'll get started. And apologies if you can hear my dog barking because the doorbell's just gone. So first question, which I think probably is one that many people have wanted to know the answer to. When children have a TOF OA repair, do you think it's beneficial for them to have regular respiratory physiotherapy?
Okay, so in a short answer, no, not for everybody. Not every child with OA, TOF, following repair, respiratory intervention isn't always needed. What respiratory physio does, it helps move secretions from your lower airways up into your higher airways. So, and that just then enables the child to be able to cough them up independently. So some children with TOF simply just have secretions in their upper and their higher airways. And so there's lots of advice we can give, but physio-specific techniques aren't necessarily indicated. For those children that do need those techniques, this is usually identified by your consultant, and then a referral to physio is made for that full assessment as to what is needed and so on. But it is really important to remember that every child is different. So the need for respiratory physio is often related to other challenges as well. So that might be the presence of an underlying respiratory condition other than just your TOFs, recurrent chest infections, tracheomalacia, feeding difficulties, aspiration. So there are lots of other factors that can impact that need for physio. There are some children that need physio intervention. You know, if they do need it, again, it might just be for a short time, it might just be initially in the early years. Others may need it as they're growing older, for a longer period of time. Some children just need none at all. So it's very specific to the individual child and the symptoms that they present with.
Yeah, that's great. Thank you. And a mum of a child that's gone under with a TOF OA repair has asked, would physiotherapy be useful, or is there a risk of harm, say, to the connection, the joint?
Yeah. So post-op, children are usually admitted to, obviously, the intensive care unit initially post-op, and they're really closely monitored. Now, at that time, they're usually on medications that can make them quite sleepy and more relaxed than normal. And so all of this can, as well as obviously the TOF itself, can impact on the need for respiratory physio. I can obviously only speak on behalf of what is done in the hospital that I work in at Alder, but all children post-op are assessed by a respiratory physio. And this will just identify if they need their input or not. Now, if they do need respiratory physio input, there are often really strict guidelines that are given by the surgical team, so the surgeons who perform that repair. And this is because there's extra care needed to, again, the new connections made, rightly said, to protect them. There's lots of attachment, lines that your child may have. And all of this, you need to just be extra cautious around. If it is needed as well, the techniques that might be used may differ slightly to what you may have seen or heard of before. And this is just because there might need to be a more gentler approach, less handling, more precautions initially post-op. But again, physio should usually assess your child post-op, and this, if it is needed, it's very much guided by the surgical team, what is safe to do and what isn't.
Okay, thanks for that. That's great. And I'm going to hand over to Trace, who's another one of our trustees, who's going to ask you some questions about secretions and clearing them. Trace.
Yeah, brilliant. Thanks, Duncan. Hi, Laura. So we've had a question, which is, could you please tell us the best techniques to use to help to remove mucus from the chest?
Yes, so we could go on. So I could talk for a long time about this, but again, before I do talk about techniques, again, they're not for everybody. So it's really, really important that before starting any techniques, your child or young person is assessed by a respiratory physio, because they're not necessarily suitable for all. But if your child struggles to clear secretions, and by secretions, that's the same as mucus, people, call it a different name at times, but there are lots of different techniques that can be used. And this mainly depends on the type of secretions and where the secretions need to be cleared from, where I mentioned a minute ago, and also the age and the ability of the child that needs to clear them as well. So, for example, you can have secretions in your upper respiratory tract. So that includes your nose, your nasal cavity, your mouth, the back of your throat, your voice box, and as well as you can have secretions in your lower respiratory tract. So that is your trachea. So your windpipe, your lungs, so your upper parts of your lungs, the middle part, lower parts of your lungs. Now, for those children who have that mucus and secretions in their upper airway, they often don't really need specific techniques from physio to help clear those. And to help clear secretions that are sitting in your upper airway, what we really just want to do is encourage bigger and deeper breaths so that we can get the air behind these secretions to shift them that bit higher so that they can be coughed and cleared, or swallowed at sometimes as well. But so we can move them and they can be cleared more easily. Now, we do often see children that just have upper respiratory tract secretions, and there's lots of advice that we can give. Some things like bubbles and blowing games, so anything that encourages your child to take a really big deep breath in to get the air behind that phlegm. Blowing games we often use obviously for the younger children, but a straw into a bowl of water with washing up liquid to just blow and create lots of bubbles, anything that just gets that big deep breath in and that forceful breath out to help loosen those secretions. One of the biggest things for upper secretions is activity. And as physios, we bang on about this all the time, but it's super important. And again, depends on the age and the ability of your child. But things like bouncing games on a trampoline, up and down on your knee, if they're older, running, sports, anything like that, just all to help to take that bigger breath in. We sometimes encourage for those upper secretions a technique called huffing, and it's like a harsh breath out, like a breath, as if you're steaming up a mirror. And sometimes that force can just help bring those secretions up into your mouth so they can clear them better. Now, that's obviously for your upper secretions. So for those who need respiratory physio, it's those children who have secretions in their lower respiratory tract, so lower down in the trachea, windpipe, and their lungs as well. And for these children, they're often children or young people who have been diagnosed with lots of chest infections, may have had lots of courses of antibiotics before for respiratory tract infections. Now, this is usually when there are more specific techniques that are needed. And what we aim to do with that is any secretions that are in the lower airways, we're trying to mobilize and move them higher up into the main airways, then your upper respiratory tract, so they can be coughed out and easily cleared. Again, like I've said before, it's really important that each child's assessed for the right technique, but there are a few techniques that you may have heard and seen before. Now, one of the main techniques are something we call manual techniques. Now, I'm just going to share my screen and just show you an image of these techniques and devices as well as I go along and talk about them. So you should see that now. Yeah. Perfect. So this is a technique. So manual techniques are the first lot of techniques, and they include two forms of techniques. So they include a technique called percussion, which is what you can see here, and then expiratory vibrations, which is what you can see here. So if we go back to percussion, this is basically a technique that uses a nice cupped hand, like you can see on the picture, and we're basically firmly patting over the rib cage. Now, the reason we do it over the rib cage is because your rib cage houses your lung fields, so your lungs are directly underneath them. So we're patting over the lung fields where those thick, sticky secretions lower down can often sit and stay there, and they're the ones that are often really difficult to move around. And when they stay down there for long periods of time, your lungs are really warm, wet environments that can breed infection, and we want to keep that phlegm moving. We've all got phlegm, but majority of us can move it effectively. So when it stays down there for long periods of time, it can breed infection. So percussion just helps to move and loosen those secretions around so they're not sticking against the lining of the lungs. When we're looking at expiratory vibrations, sorry, it's a difficult picture to see, and you kind of need to see the technique done. But what we mean by two hands on the chest wall to support the chest wall and to provide that gentle oscillation as a child takes a breath out. And what that oscillation does is it helps to guide and move those secretions that you've loosened already by doing the patting into the main and higher up airways. And it also helps, so we do it on a breath out, and what that naturally does is helps the individual child take that bigger breath in afterwards, so it gets the air lower down and helps shift those secretions even more. So sometimes some children have just percussion prescribed, sometimes they may have both of them, and again, it's very individual, but they are two of the main techniques that, if needed, we tend to use with our younger children who need that more passive approach to their physio. Now, and other techniques that we might use for more of our older children, some younger children, depending on their ability, but some of our older children is a technique called PEP therapy. Now, there's a few devices I'll show you here, and this just there's a long list of devices that can be used, but these are the main ones we use in Alder Hay. But PEP therapy, it stands for positive expiratory pressure. And it's basically a type of airway clearance that generates a pressure against the individual's breath out that helps to splint your airways open. And what this means, it just helps the air to get lower down behind the secretions, and the secretions to help the secretions to shift up higher and mobilize and clear them better. This device here is called a PariPep. Very small little plastic device, but really effective. And what we encourage the child to do when they're using this is to blow out a nice, long, consistent breath out when they're using this. You can change the resistance, and what the resistance is, that's the resistance against their breath out, which helps create that pressure. So your individual physio would guide you on the right resistance for each child, because every child is different. But this is one type of PEP therapy. Another one is the acapella. Now, some of you may have seen this, some of you may not. It's now a blue colour. I think it's changed colour recently, but this is exactly the same. You encourage your child to do a nice, long, consistent blowout through this device. But what this adds in is it adds in oscillations as well, so vibration. So not only does it give that pep to help get the air lower down, but it helps give that vibration to almost shake and loosen those secretions a little bit more. And that's the same as the aerobica. The acapella and the aerobica are very similar devices. They're just different devices. But again, it depends on what's more suitable for your child. But it's usually, because it really just depends on a really good technique when you're using these devices. So it's usually the older children that will have these devices in part of their physio plan. There are also techniques and other things that we may need to add to these techniques. So sometimes, despite all the physio techniques that you use, the adjuncts, the equipment, some children have super sticky, thick secretions that are trying to move, but it's really, really hard to move them still. So we do introduce sometimes things called saline nebulizers. Now, this is just an image of the equipment that we use, and again, there's lots of equipment out there, but saline nebulizers are saline is a saltwater solution, and the nebulizer is this device here that delivers that saltwater solution as small liquid particles. And what the salt in these nebulizers do, it helps trigger a stronger cough. So it's a bit of an irritant to help trigger a stronger cough. And also it helps draw water from the cells around the airways into the secretions and the mucus to help loosen it up a little bit. So this, alongside other adjuncts like the aerobica, your PEP devices, your manual techniques, can sometimes be useful at helping make these secretions easier to cough up. But again, they're not for everybody. There are different strengths of salt nebulizers. There's different bits of equipment that haven't been included here, but not for everybody, but they can be things that are included in a physio plan. It's what your child needs.
Thanks, Laura. Okay, so I think the next question really you sort of answered, which was, does beating firmly but gently on the back help to clear out or disperse secretions? So you covered that with the cupping of the hand, yeah?
So that's your percussion technique. And again, it seems like a very simple technique to do, but there's certain areas we'd use that technique. There are certain reasons why we wouldn't use it on some children as well. So I would encourage that you don't just start doing this at home. You do make sure that this is safe for your child before you do introduce that. But yeah, that's the percussion technique.
Okay. So so this leads us on to children struggling with coughing. So often due to mucus trickling down the back of the throat and onto the chest. So A mum of a 3-year-old asks, after every single respiratory virus our son catches, it takes weeks for him to get rid of the horrendous cough. Sometimes before the cough goes away, he already catches a new virus and so on. Do you have any suggestions for ways to decrease the time it takes to recover?
Okay, so coughs can be a tricky one, and it can be a tricky one for everybody, whether you have a TOF or not. So there can be many different reasons as to why you might have a cough. Now, it is really, again, important to remember that if there is a cough, you always make sure that any concern around that is assessed first, because it might be related to a number of different things that physio just can't help with. It might be TOF cough, which are all, I'm sure, experts at knowing the TOF cough. Might be reflux, aspiration, respiratory virus. So like in this situation, you might have lots of upper respiratory high secretion, nasal congestion that causes that post drip to the back of your throat. Might be airway inflammation, might be related to lower respiratory tract infection, asthma, allergies. So there are lots of things that, and not all of those are what physio can help with. But if you do have recurring respiratory virus, lingering cough can also be quite a normal part of the recovery. And I think this has probably shown us all that the cough colds we've been getting has taken a long time to actually get rid of. So it's not always something to worry about. But sometimes it can leave individuals with what we call a hypersensitive cough. So that's when we cough due to an unharmful stimuli. So our cough sensitivity is super high and we need to be coughing all the time. It's often quite a dry sounding, irritating cough, so different to that wet cough, different to that barking TOF cough. And there are generally really simple things that we can do to help minimize that and reduce that. So one of the big things that we suggest is super good oral hygiene. Now, brushing our teeth, good dental health, that can all have a real impact on things and to do with that dry, irritating cough hypersensitivity. Drinking plenty of fluids, drinking plenty of water, avoiding that dry mouth, that dry throat. There's a technique that we sometimes use in physio for those hypersensitive coughs. It's called the stop cough technique. And all that involves is we try and control the need and feeling to cough. So for those who have that hypersensitive cough, and we've all probably experienced it before, it's that tickly feeling at the back of your throat, or that throat clearance that just doesn't go away. And the more we do that, it's a vicious cycle with that dry cough. The more we do that, the more we irritate our upper airways, the more we then need to cough. And it just goes round in circles. So a stop cough technique is controlling the need and the feeling to cough by doing things like swallowing, drinking water. And then in time, the cough sensitivity tends to reduce back to normal. However, again, it's not for everyone. For our younger children, it is often much harder to do that. But encouraging drinking water and having a big swallow when you do notice they're coughing is super important too. But one of the big things that we focus on in physio and that can have a real impact on a cough is an individual's breathing pattern. So, and that comes down to your nasal congestion and your upper respiratory secretions that can often get with a respiratory virus. And this physio, we often identify what we call breathing pattern disorders, so dysfunctional breathing pattern. And all that means is breathing from a rather than an efficient way to an inefficient way. And that's because you're using the wrong muscles and breathing in the wrong way. So to explain it simply, everyone should ideally breathe through their nose and not their mouth. Now, lots of us mouth breathe and we get away with it and there's no problems. But for lots of children who have respiratory viruses or respiratory complications, quite often we find that they are big mouth breathers and they've got so used to that. And especially those children who have struggled with nasal congestion or just have an inability to effectively breathe through their nose. Now, the reason we ideally want everyone to breathe through their nose is because your nose does some really important jobs that help protect your upper airways and your lungs lower down. One of the really important jobs is it contains lots of tiny hairs that line your nose and your upper airways. And what those hairs do, they filter out any dust, allergens, or pollens in the air so that the air is cleaned and filtered before it gets to your upper airways and lower down to your lungs. You have lots of blood vessels there too, so it helps to warm up the air, so it's cleaner and warmer air. It acts as a bit of a humidifier when you breathe through your nose, so humidifies the air, which is always nicer than that dry air. And also when you breathe through your nose, the air passes through your adenoids and your tonsils, so it helps to clean the air surface. It kills bacteria, kills viruses. So it's much healthier air when you breathe through your nose. Now, there can be lots of reasons why it's more difficult to breathe through your nose, but again, respiratory virus can be one of them, especially if they've been very nasally congested. There are exercises that we do often use to promote a better breathing pattern in physio and to reduce nasal congestion. There's a certain technique. What we want to aim to do is to improve the child's tolerance of nose breathing. Now, as simple as that may sound to us, trying to encourage someone to nose breathe when they've been breathing through their mouth for a long time is actually super difficult. It's trying to change your pattern and habit of breathing, which is really hard to do. But the more we do it, the easier it becomes. One technique that we use, and again, for a really younger child, it's probably not suitable. It's usually for we use this for 4 or 5 and above. But if I just share my screen again, you may be able to see this. So it's called a nasal washout. So basically a blue teapot. It's a Neomed sinus rinse, and you may have seen this before. You can buy them in local pharmacies. They're really easy to get hold of. But all this involves is you mix a salt water solution. There's a specific way to set it up. You wanted to use sterile warm water, but you mix salt water solution and you pour that into your nasal cavity. So you pour that into your nostrils basically, and it passes through one side and passes through the room. What it does what it says on the tin. It helps to wash out your nose and your nostrils, and it can really help to loosen any thick, sticky stuff that's got stuck up there that can often result in that dry cough, that post-nasal drip, that inability to breathe through our nose. Again, it's not suitable for everybody. There are some situations where we wouldn't recommend it, so always get that advice from your consultant or your physio. And for a 3-year-old, this is super difficult to do, and I've not yet met a 3-year-old who could use this technique. So all we'd really encourage there is things like techniques and games to promote a better nasal breathing pattern. So, for example, a competition, how long can we keep our mouth closed and how long can we breathe through our nose? Can we do it for all the adverts before the TV program starts? Can we do it for a whole song? Practicing alternate nostril breathing. So sometimes in a humidified environment, like once the shower's been on, in your bathroom, covering one nostril, encouraging to take some breaths in and out through one side and the other. And it just helps to focus on each individual nostril to loosen any secretions that might be there, if it's obviously related to hypersensitivity and that dysfunctional breathing pattern following a viral illness.
Okay, brilliant, thank you. Moving on, it's a similar situation really. A few parents have asked, what is the best remedy for a cough during the night, especially when their child has an infection or pneumonia, please?
Yeah, so again, nasal washout, if they're quite congested, when you've got a chest infection or, anything, you can be, and that's a really, nasal techniques to encourage nasal breathing can be really important and useful. Again, depends on the age and tolerance of your child, but if a child has a chest infection, they're likely going to have chest physio already in their plan if that's something that they're known to have often. So I do sometimes advise parents to do this just before bedtime, before going to sleep, so that they can improve that airway clearance, clear the chest as much as possible before bedtime. Because quite often it's when you're lying down flat and you're still, and then suddenly you start to move again, any secretions that are sat there and they start to shift, that can result in those symptoms and that coughing and that difficulty clearing. It can then help them have a more settled night's sleep, that better airway clearance. Sometimes, and this is as per your child's individual plan and the guidance from your physio, but usually for my patients, if they have physio intervention when they're unwell, the chest infection, their physio regime may increase, so we do it more regularly, and the timings of that may increase, so that should be on the plan, but that's what we generally would advise. Positioning is often really a forgotten technique, but it's super important, especially if you've got a chest infection. And quite often we go to bed and we lie on our back, and that's the worst position if you've got secretions on your chest, to just lie flat on your back. So making sure you're gradually repositioning your child, going from one side to the other side if they're younger, naturally when they're older, they'll move around anyway. Propping them up with pillows potentially just to help so they're not flat on the back. A real simple but can be a really effective way to help clear the secretions. But again, they follow the plan, but simple things like that can be really helpful.
Brilliant. Okay. So the next question I think we've covered, because that says, are there any general tips that you can give parents to help manage coughs? So I think you've covered quite a lot of that for us. And then what is the best indication of when a TOF child needs antibiotics?
Okay, so it's very difficult because it's different child per child. You know your child best, so you will know when something's not right. But what I always advise, if your child presents with any increased respiratory symptoms that is outside their normal, get a medical assessment. Now, antibiotics are for an infection, and you only truly know if you have an infection, if you have that full assessment, someone has a stethoscope or listen to your child's chest. A lot of the signs and symptoms can be very similar to an upper respiratory tract infection, so upper respiratory tract secretions, where your child won't necessarily need antibiotics. So having that professional listen to your chest is really important. But if your child does have physio input and they've got a plan, then usually on the plan we'd always advise that there are signs, that there are specific indicators for look out for this. That might be they're working harder with their breathing, they might have more secretions and mucus than normal, their mucus might be thicker, there might be more of it, it might change in colour. That's a real good indicator. And quite often we ask for sputum samples, so we use samples of the mucus to test that out to see if there is infection. They may have more breathlessness, and they may be coughing more than normal, temperatures, and just generally feeling unwell. So again, some of these things may be completely normal for one child, but that's completely different for another. So you know your child best. So any changes in anything, then definitely get them assessed.
Great. I was just going to go back to one of Duncan's first questions, just because I think that also there is a mum that might have asked, what this child has not undergone their TOF repair yet, and when they do, would physical okay, so you did cover it. Sorry, I thought it was they hadn't had the surgery, and could they do physio, but it's not like saying after the surgery, so that's fine.
Yeah, again, even without, I mean, usually that happens at a very young age, so it's usually we get involved post-surgery, but at any point in time, a physio can assess to see if anything's beneficial. It doesn't mean that it's just before or after, but afterwards in our hospital, we usually always assess, and then we just get into the surgeons immediately post-op.
Okay, brilliant. Thank you. So I think, Duncan, you're going to ask a few questions about breathing and asthma now.
I am, yes. Thank you for that. And as I apologised at the start for the dog barking, I've now got my wife teaching singing downstairs. So we've got a bit of Andrew Lloyd Webber going in the background. So if you can hear that, that's what it is. So first question about breathing and asthma is, we've got a parent asked, got a 3-year-old that is out of breath quickly when running around. He has confirmed tracheomalacia with up to 70% restriction. Is there anything we can do to help them?
Okay, so tracheomalacia is often a really common symptom in many children with TOF, which I'm sure you all know. And physio itself, respiratory physio itself, isn't a management for malacia, but it can help manage the symptoms. So, for example, lots of children with malacia might struggle to clear mucus, it may get stuck, can be harder to clear due to the closing of the airways. Now, it can also really affect activity, and it can be really difficult to manage, especially with your younger children who already don't know how to stop and pace themselves. You're often watching them run around and thinking, oh, what can I do? I want to stop them. But it's really important that we don't stop them being active. We want to encourage them to be active. It's a really important part of their development, whether they're a TOF patient or not. And, it's a really important part of their development. So it's important to continue letting them be active, but things that we usually advise, especially for our younger ones, are working on pacing techniques. So working on ways where we can encourage them to have regular rest. When they're resting, encourage them to change their breathing pattern. So for most of us, when we're exercising or running around, especially our younger children, we're breathing with our mouth open. We are real mouth breathers. It goes back to what I was saying before about our nasal breathing. That's an inefficient way to breathe anyway. We all do it when we're exercising. But if we're already struggling for other reasons, it's just going to make our breathing rate even quicker, even harsher, even harder. We're going to be even more puffed out. So anything there you can just really promote and encourage that nice nasal breathing. Sometimes we say, right, stop and have a little rest, do a nice breath in through your nose and blow out slowly through your mouth. We want to slow that breathing pattern down in a good way, rather than just saying, right, slow your breathing, because we know it's not it's easy enough to do that. But yeah, lots of rest, encouraging relaxation. So quite often as well, I mentioned before about that dysfunctional breathing pattern. And so not only is it making sure that children and all of us breathe through our nose rather than our mouth, we've got our diaphragm, which is our main muscle sitting just at the bottom of our lungs, bottom of our rib cage. And your diaphragm's a really big dome-shaped muscle, and it's your main strongest muscle for breathing. So ideally, the perfect breathing pattern is we would all use our diaphragm when we're breathing. And what it does is it helps bring all the air right down to the bottom of your lungs when you're breathing in, and it pushes all the air out. So you're fully filling your lungs with air on a breath in, and you're fully clearing when you breathe out. Now, what we find, especially with children and young people who are mouth breathers, they're very tense up here. They use their mouth a lot to breathe. They use their neck, their shoulder muscles, their upper chest, especially when they're exercising as well. So that just makes your breathing rate much quicker because you're not getting that full big breath. You're not filling all your lungs with air. So relaxation is super important to help them relax their shoulders, use their diaphragm, just get that more relaxed pattern of breathing. But then not stopping them for too long, let them recover, but let them get back to it. But pacing is a really big thing. But again, I would advise that any symptoms with activity, especially if they're related to malacia, or as I'm sure you do, but always discuss with your consultant, because there may be other forms of management for that malacia or advice that they can give that's outside of physio, or we can use alongside physio advice to help you with that.
Yeah. Thanks for that. That's great. I was smiling to myself as you were talking then, because as a profession, I'm a music teacher at school, and also teach brass players as well. So everything you've been saying about relaxing, breathing deeply, using the diaphragm, is all what I do at school all the time. So it's great to know that it's the same things. You're saying the same things. Are there any exercises that people could do daily to sort of help improve their breathing, particularly for, with sports and things like that?
Yeah. Again, it probably links into that diaphragmatic breathing, nasal breathing, but it's super important because it's very difficult when we have a child or young person who really struggles with sport. And, we've seen it a lot. It's very easy to, get them to take a step back from it because you're worried about them. You don't want them to appear really breathless. You don't want them to struggle when you compare them to their peers as well. But every child should remain active. And again, the activity that they do may differ from child to child. Now, again, I'd like to share my screen today, but I'm just going to share my screen once more.
Fine.
And again, these are guidelines that are on the gov.uk website for everyone to see. And it's guidelines from the Chief Medical Officer. And on your left, it's from birth to 5 years, and on your right, it's 5 to 18 years. So this is guidelines on what we would advise, how often we'd advise you to be active. And activity for one child will be very different compared to another, but this is just a rough guidance over a weekly period, what we'd ideally advise for everybody. Even if you've got individual limitations, it's really important to remain active. But for some, it can obviously be much more difficult. Now, their breathing pattern, like I discussed before, has a big impact. Again, encouraging them to breathe through their nose, using that diaphragmatic breathing. One technique that I'd really encourage, because one big thing, like I mentioned before, we notice is that a lot of children will use their upper respiratory muscles when they're running around and they're active, but more than other. And it's that when they stop and rest and try and recover, that's when it can become really difficult for them to stop using these muscles and revert back to that relaxed normal breathing pattern. Now, ideally what we want is we want each child to, so I'll just show you here, we've got our diaphragm here, which is our main muscle for breathing, and then we've got these muscles up here that we ideally don't want any people to be using. Now, we all use them a little bit when we're exercising. It's virtually impossible to not use them when you're working hard, and that's a good part of exercise, that you come puffed out and you know you're doing the right thing. But what ideally we want to do is when you're taking a nice breath in, ideally what we want is when you take a big breath in, you want your tummy to go out. So that's your diaphragm pulling all the air to the bottom of your lungs, and you're filling all your lungs with air. And when you breathe out, you want your tummy to go in. It's a really gentle movement and slow movement, but that's what ideally we'd like to see. So your diaphragm is a muscle, and like any muscle, if you don't use it as often, it becomes weaker and it's harder to use, but the more you use it, the stronger it gets. So a really simple technique that we also teach a lot to children who struggle with that pattern of breathing that affects their activity is lying down, whatever age. This can be done at whatever age as well, but lying down, flat on your bed, somewhere comfortable, so you're super relaxed, keeping your shoulders nice and relaxed, getting in that quiet environment. So it might be a dark room, no distractions, super quiet. You might have some relaxing music on, something just to keep you super relaxed. And we encourage them to put a really light object on their tummy. So this might be a small teddy bear, or, depending on the age of your child, but usually for the younger children, their favourite teddy bear on the tummy. And what we encourage is that when they're breathing in, the bear should lift up. And that's how we know you're using your diaphragm, because your tummy moves up slightly. And when you're breathing out, your teddy bear should go down. It's hard to do it. It's hard to do if you're not used to using the diaphragm, but it can be a really easy way to practice using your diaphragm and get that muscle stronger, so that we're really encouraging that better breathing pattern. The reason we say start doing it lying down is because we're almost eliminating gravity then, and it's much easier. Everything's on a nice stable surface. It's super relaxed. Once they've got it, they've got it covered and they're managing it lying flat, we can gradually say start gradually sitting up and practice to doing it with your hands on your tummy. But that sounds like a really simple technique, but it's actually a really effective technique. And it usually can be used then if they're running around really puffed out, when they stop and rest, when they're pacing themselves, or they've stopped being active. It's usually really good then to get them right. Hands on your tummy. Let's see if we can relax your shoulders. Breathing through our nose, using our diaphragm, feel that tummy rise and fall as you're breathing. But yeah, it's a difficult one to do, but they are used techniques that we will encourage for lots of children who struggle from that perspective of activity. It can be really helpful in the recovery. There are specific exercises that can be used to improve breathing pattern, and these exercises are called Buteyko breathing exercises. Now, that's a whole day in itself, probably, or days in itself, weeks in itself, to teach these techniques, but they are specific techniques that again aren't suitable for everybody, but they just help teach and promote a better breathing pattern, to using your diaphragm, using your nose, slowing your breathing pattern down. And so they are things that we do often encourage, and children, young people are often referred to us to help us teach those techniques. But relaxation, diaphragm breathing, postural advice, so making sure we've relaxed our shoulders. It's super difficult to stop using your shoulders to breathe in your upper chest if our posture's like this all the time. But just to try and change that pattern of breathing can be really, really helpful, especially with activity.
That's great. Thank you. Some really good advice there. So yeah, absolutely. Right. One for quite a few parents, I would imagine, who've got teenage children. One parent asked, I've got a 14-year-old child who won't use their nebuliser. Have you got any tips, suggestions about how they can encourage them to actually use it?
Yeah, so we see this an awful lot. So you're definitely not on your own here, and I'm sure everyone else is great who's had a teenager or got a teenager, but adherence can be a really big barrier to treatment compliance, especially when they get to that age. And they've got much more important and interesting things they want to be doing. They've got schoolwork, they've got exams, social events, and they just become more of a priority to them. So you definitely won't be alone with this concern. I see a lot of patients around this age who have daily airway clearance plans. So that may include nebulizers, PEP devices, and they do often describe it as a burden to them. I think the biggest thing that I like to focus on, and I think is really important, is ensuring that your child or young person has full understanding of their condition. And that might sound really silly, but around why their physio, why their nebulizers are so important. Often our children start on these regimes, these physio techniques at quite a young age, and it's something they do because they're told to do by their parents. And so as they grow up, they get to a certain age when they start stopping and thinking and asking the question, why are we doing this? And other things are more important to them. If you've got an individual who is educated and fully empowered in their knowledge and they're actively engaged in their treatment and decision they make around their treatment, then this can often result in their changing their beliefs and their feelings about their treatment, about their physio, and hopefully then will impact on their actions. So first and foremost, I think any questions they have, making sure they're fully aware and of the benefits and the reasons, they've got that full understanding of their condition and their treatment. Sometimes they may perhaps prefer to do another physio technique over another. I mean, ideally, what's in your physio plan is the best thing for you, and doing it all is perfect. But sometimes we have to bargain with patients. So we have to bargain and say, okay, you might not want to do your nebulizer twice a day. You might not be doing it, but rather than not do it at all, can we maybe just start doing it once a day and we'll work on the rest? So trying to work out, is there something that they will do over one technique? And again, alongside your physio to make sure that you're not stopping something that is super important. Activity is really, really important. It's a really important part. I know I've spoken about it before. It's a really important part of airway clearance. So sometimes, especially for those children who are now young people and much older, sometimes we get to a point where we can actually, if they become more active and do that day session of activity every day, that can be that can be their physio session itself. So it might replace their afternoon physio session. It might replace their morning or their evening, depending on what's, guided by your physio. But sometimes that's what I tend to do for the older ones. If they can focus on something that they enjoy more, but it's still as effective, that can be helpful. I think making it a habit, and this is probably more for our younger children as well, but making it a habit. So putting ingrained behaviours together. So, for example, brushing our teeth. Lots of children when they're younger don't like to do it, and it's a bit of a battle to get them to do it. But as they grow older, the more they do it, it's just a habit. So often popping like nebulizer equipment, physio equipment in a place where they have to go to every day at the same time. So if they set an alarm each morning, set an alarm each night, they have to switch it off in the morning, set it at night, put on their physio or the neb near there so they remember, oh yeah, I've got to do that. And I often have lots of patients say to me, I just forgot to go and get my neb equipment, or I just couldn't be bothered going downstairs to get it. And so popping it in a place where maybe it just triggers that memory a little bit too can be helpful. I also try to do all of the above, all of that really as soon as possible. So quite often some of the mistakes we sometimes make is we wait until they get to their teenage years before we try and fully educate, because we think they won't fully understand, and they're obviously going to understand more at that age, but trying to get them actively involved in their treatment as soon as possible, as soon as they're able to, so that when they get to that stage in their life where they have so many things going on, it's a really stressful time, they're already at the point where they're okay, it's a bit of a fact, it's a bit of a pain, but they're understanding it more and they're more accepting of their physio rather than waiting to that point. It could sometimes just make it slightly easier.
That's great, thank you. And finally, a mum of a 16-week-old little boy, I wonders if you've got any suggestions as they prepare to come home.
Yeah, so I'm obviously only here from a physio perspective today, and there's so many people involved. I'm sure that it's sometimes a bit mind-boggling the amount of people that are involved, but I'm only here from a physio perspective. But if I can offer any advice, it would be to use the expertise and the experience of your healthcare professionals, all of those individuals who are involved in your child's care. Have contact numbers, find your best way to contact them, whether it's a nurse, whether it's your consultant, use the resources available within your local team. Seek support from your peers. So like the TOF charity, like these sessions, I think they're super helpful. Seek that support and speak to other people who are, every child is different, which is important to remember. And just don't be afraid to ask questions. No matter how silly you may think it is, there'll be someone else probably wanting to ask the same question, has already asked it, or feels it's a very good question to ask if you need to. So use the resources that are out there, definitely.
Yeah, absolutely. And I was going to add on to that one, look at our Facebook group, because lots of parents I know, it's always the worst late at night, about 2-3 o'clock in the morning, when something's not going right. And often parents are putting little things on there, and normally there's two or three people are always giving their advice, help, support. But like you said, absolutely, every child is different, so we need to make sure everybody needs to take that that advice into hand. Laura, thank you. And it's been a quick whirlwind tour through physiotherapy.
Probably not everything and I apologize. I realized I was standing up showing my diaphragmatic breathing and was sharing my screen still, so if nobody saw that properly, then please.
You weren't. You were fine. No, you were on the normal camera, so yeah, you were fine for that. Otherwise I'd have shouted up and said we can't see you. So Laura, again, thank you for your time. If you want to stay, you are more than welcome, but obviously from your background we can see you're still at work, so feel free to stay. If you want to go, please go, because we understand. Thank you for giving your time. We always appreciate people giving up their time for us on an evening. It's immensely appreciated. So thank you. Thank you, Trace, for joining me again tonight, and Claire, thank you for organising it, and I'll hand over to you so you can sort the breakout rooms.